who's the typical dental implant patient?
Yeah, so I mean, I would say that really falls into two major groups, right? So you have people who don't have any teeth anymore, right? So they've been wearing dentures. And then you have people that are being told that they're more than likely going to be ending up in dentures. They've been going through this, treadmill of having to go to the dentist and get this fixed and that fixed, and this hurts, and this doesn't look so good, right? Teeth are breaking down, they're falling out, their gums are bleeding, they got bad breath. By the time they fix one problem, another one's already turned up. So they're looking for a new solution for that. And so they've been told that they're going to be getting dentures. And for those people, we're going to give them a brand new set of upper and lower teeth that don't have to come out.
Okay, that's nice. Who's the second group?
So the second group are people that we can probably help the most, and that's the ones that are already in the dentures. So they've been coming to the dentist, and instead of getting their root canals and their crowns and things like that, now they're coming back every so often for an adjustment. They've got a sore spot, they've been having to glue their teeth in all the time, they're having to get relines, things like that, and they're looking for something different too. So for them, of course, we can give them teeth, upper and lower, in the same day that don't have to come out.